Your turn.
Hey everyone.
You gotta go up there. You have to probably pull your mask down so you can be heard.
You can stand right back there. You're okay.
You probably don't want to be muffled, so I would pull the mask so you can be heard. Because this is you being heard.
Hey everyone, it's Aria, Miss Black Oregon International Ambassador 2020, and I am here demanding justice with my colleagues. We are not going to stand for any more police brutality. We are not going to stand for the miseducation of our children. And with that, I'm here with my fellow co-authors. We have produced a riot control agents report, and we will be fighting justice all the way through the federal court to ensure that Judge Hernandez grants a ban on tear gas.
Hi, my name is Dr. Anita Randolph. I'm from OHSU in the Department of Psychiatry. I served as a principal investigator on the article educating the public about the harm of using riot control agents such as tear gas on the public. So I hope all you guys read it, understand all of the health risks that are associated with it, not just to humans, but also to the ecological system and pets. So I'm just here to educate so that everybody understands that this toxic chemical needs to be banned, period.
My name is Donovan Smith. I'm a writer, artist, and producer here in Portland. After doing this research on tear gas and riot control agents, I was somewhat surprised by what this thing actually is, and it is a public health threat that is deceiving, the words that we use when we call this thing a tear gas. It's a chemical compound that has already been banned for military uses through the Geneva Convention, and the question mark just stands over this, so why we would use this against people who are protesting for justice in our city and across cities throughout America. So I encourage everybody to look through this document and kind of come to the obvious conclusion that we have, that tear gas needs to be banned now.
Hello everyone, my name is Sadora Williams and I am a licensed clinical social worker and owner of Sankofa Center for Healing, and I am here as a therapist, as a mental health advocate, as a speaker to encourage you all to look at the document that we have put together around the research that supports that this tear gas should be banned because of the mental health aspects, and also to bring more awareness to the fact that this is an area that has not been studied, is the mental health effects of actually using riot control agents on protesters. But what we do know is our current state of mental health, we're in a mental health crisis. We're in a mental health crisis, and you guys are doing things to exacerbate this crisis that we do not have the resources to even accommodate or even meet the demand of. We already have people that are seeking treatment and left untreated because our facilities are full to capacity, and created wait lists of people who might be experiencing trauma, who might be experiencing anxiety or panic attacks just from being exposed to tear gas. So we need to be aware of the alarming impact that the use of tear gas can have, not only right now, but long-term effects. And we need to do something about it, because we should not be contributing to our mental health crisis when we do not have the funds nor the resources to support the people that are affected by it. So thank you all. Please read our document that we have put together, and yes, do what we need to do to protect all of our community members.
So as the Chief Public Health Consultant to Don't Shoot Portland, I would like to thank our leader, who we do love so much, for encouraging and empowering us to do this research, Teresa Rayford.
So my name is Teresa Rayford. I am the founder of Don't Shoot Portland, and one of the reasons why we brought this lawsuit forward is because as a Black Lives Matter activist, I've seen firsthand the amount of violence and aggravated assaults that are inflicted on Black-led organizations and the protesters that show up in solidarity for our movements. The fact of the matter is that in the time of this current uprising, we were in the middle of a worldwide pandemic where we knew that any attack on our respiratory systems would cause harm and even death. One of the things that occurred to me as a person that lives in downtown Portland is that the fact that we've all been quarantined for at least 60 days, that there is going to also be an emotional and a mental impact on the type of violence that is used aggressively against us when we stand up for our civil rights and our freedom of expression. And to see that the acceleration of agents used and the acceleration of force being used on people, again, that have been quarantined under a federal rule of law that basically created a circumstance of basically shutting us off from usual and social paradigms, I believe that that added to the trauma of activists. I believe that not only the force of the extreme use of intoxicants, but also the trauma involved with the violence, and I wanted to address that. And so we brought together this study because of the first-hand accommodations that I received from the experiences of the people on the front line. The fact that even though there is a crisis and a pandemic that is happening, that the use of force, the type of weapons of force, and the type of tear gas that is being used is exasperating the trauma that people are experiencing in regards to standing up for Black lives. And so I've asked Danielle James, who is a frontline person that has been standing on the front line providing jail support to people that are actually being arrested during the protests, which is a very essential need for these type of movements, to share her experience because she did inspire this lawsuit. Thank you.
Thank you. Hi, I'm Danielle James. Boots on the ground. There are things going on out here to protesters, local activists. Many people of color, I feel, are being targeted. They are shooting at our bodies, tear gas canisters, rubber bullets. There's something new now they've been using against us with buckshots in it that are spreading and hitting folks in the backs of their legs, in their head. I appreciate all y'all. This Black excellence back here is beautiful. This is the support we need. I would like to ask the city to come out and join forces and come out here and support this movement. This is a revolution. It will rise. I appreciate Don't Shoot Portland for doing the footwork and getting this started and initiating the restraining order against tear gas. I have many accounts of people being hurt around me, people doubling over in pain, throwing up. It is mentally traumatizing because I'm going places I can't not look over my shoulder, and when stuff hits the ground, I jump. There's many levels of trauma here that is being bestowed upon people who are literally just standing up for Black lives. So the word needs to be out that we're coming, we're fighting, we're not stopping. I'm gonna be boots on the ground to the end, and I hope to see the change that we all want to be brought about. I appreciate y'all for being here. Thank you.
And so many are probably wondering why we are gathered here today in front of the federal courthouse. We are gathered here today because Don't Shoot Portland filed a class action lawsuit against the city of Portland. And we're excited about this because it's time to ban tear gas. And also we decided to do research that would be impactful, especially as it relates to the lack thereof of knowledge in certain areas. And so with that, I would like to present our Rooted brand ambassador and public health consultant, Dr. Anita Randolph, to give more information regarding some of our critical findings as it relates to the study that is now published online, Don't Shoot Portland website.
Hi guys, I'm Dr. Anita Randolph. A lot of the findings that we found were actually quite disturbing. So even me, prior to researching tear gas, I really didn't know how harmful it is to people, to the environment, to our pets. And it was really interesting that people think tear gas is actually like a gas, but it's not. It's a solid, right? And so since it's a solid, you have to mix all of these chemicals in that container so that it can be dispersed as a gas. Many of those chemicals that are inside of these canisters, these grenades, are actually extremely toxic. When you look at the MSDS reports online, it just simply says deadly, lethal, don't get on your skin, do not inhale. If you inhale it, go to the emergency room quickly, as fast as possible. Do not put into the environment. Do not flush down the sink. Do not put in stagnant water in the environment. It causes adverse ecological effects. And so why are we using these chemicals in Portland? Portland is supposed to be one of the leaders in keeping things natural and safe in the environment, and we're using chemicals that strictly says do not put in an environment, do not put in the water source, because it can cause a lot of ecological harm. And so with that, I stress people to understand why these chemicals are really toxic. The second thing that we found was that a lot of these chemicals are actually deadly or harmful to people who are pregnant. A lot of these chemicals can cross the barrier, and when these people deliver and their blood is tested, they see that these chemicals are actually still there. So we know that when the fetus is developing, they're actually exposed to that because it can cross a lot of these barriers. The other thing is that since tear gas is a solid that needs to be converted to a gas, you have to have some type of dispersion machine, these RCA machines. They actually cause the tear gas to be in these little aerosol droplets that are about 3 to 5 microns, right? But when you get exposed to tear gas, what do? You cough, you sneeze, you start to tear up. Well, your respiratory droplets that can spread COVID-19 is almost identical in size to what the machine disperses the tear gas in. So how does these machines distinguish between a micro droplet and a respiratory droplet, right? How do they distinguish that from the aerosols that they are using to create the gas? It can't distinguish. So as they're spraying the tear gas, they're also dispersing particles. We don't know how many people have COVID-19 due to the lack of testing that's available for many groups. And not only that, 35% of the population is asymptomatic. So what if you have these asymptomatic people here in these protests, and then you spray them with tear gas and they begin to produce these respiratory droplets that is being further dispersed by the use of these machines. And then secondly, I think that people have to understand that one canister of tear gas can reach a radius of like 400 meters. That's like one loop around the track. That's a lot. And then the radius is like over 300 meters square. Not only that, it can actually penetrate glass. All of these buildings that are surrounded by the areas that are being tear gassed, they actually have to do some type of detoxification, and I don't think they're understanding that they have to do that. And we see that with so many studies, even in prisons. When people use tear gas in prisons, the prisoners have all of these respiratory effects because the areas weren't detoxed before they went back in. So it's important to stress that these chemicals are water insoluble. Rain is not going to wash them out. It's going to linger into the environment. It tells you don't put it in the water system. It's out in the environment. It can't help but to go in the sewers when it rains. All of these buildings have glass. Tear gas can penetrate glass. And I'm even sure that the police don't even understand that they too have to park their cars at least 400 meters away from where they're dispelling the gas, because the range of one canister is 400 meters. So there's so many standard operating protocols that are being overlooked because we just naturally think that tear gas has been around since the early 1900s, and so we just assume that it's safe. So I'm just here to stress, from a scientist's point of view, this is what I do for a living, that we really need to look at the chemicals that are in these canisters to turn tear gas from a solid to a liquid. They are also just as deadly as a CS. And even if we look at other forms of chemical agents that are used to make tear gas, like OC, pepper spray, we know that when we do these extractions, the content that creates the pepper spray is different between each chili pepper. So just there alone, we really don't even know the dosage that is going into these tear gas, right? And then tear gas is also manufactured all around the world. There's no standardization about the concentration that needs to be in each canister. So, you know, we don't know. And then also pepper spray, sometimes it's OCCS. It's like all different forms of tear gas in one container. And so I'm just really stressing upon leadership, government, the police to really understand what they're doing. And it's also a safety not to us and environment, it's to them, you know? Why are you putting this out into the community? You're standing right next to it. So even though you're covered, we know that these chemicals can, you know, disperse and really cause a lot of harm. And then the repeat exposure that they're, you know, putting themselves under, I just want them to understand that it's very detrimental to their health. So those are some of the key findings in the scientific chemical portion that I did. So I hope that you guys enjoy reading it. We worked really hard on it. So yeah.
And next we will have information provided by our mental health aspects of our tear gas report from Zadora Williams.
So what was found when I did my research was, like I said, it was a significant area that has not been studied. Although there has been countless reports from actual protesters of their mental health symptoms, that there is an increase in depression, that just being next to or exposed to or witnessing this violence taking place, that you're already exposing yourself to vicarious trauma. And if you are, in fact, come in contact with tear gas, you're experiencing shortness of breath, fear of, am I dying, that sense of panic. So we're seeing an increase in panic attacks. We're seeing an increase in PTSD, as the woman just spoke about earlier. Like, she hears a can drop or any sound and it's like, okay, I'm looking over my shoulder. These are the things that we need to take into account, is that our mental health a lot of people's mental health is already compromised right now as they fight for the injustices that has been plagued upon the African American community. So just showing up, they're risking their lives. And our government, our police department, these are things that we can do just to try to help not cause further harm. Our people, we don't have the capacity to meet the need that is created when it comes to re-exposing people to trauma, increasing symptoms of depression and anxiety just for people to fight for rights. It's not okay. So I encourage you, take the time, read through the mental health section, and just inform yourself of how, when people engage in protests, how their mental health is affected, whether they actually experience the trauma of being tear gassed or not. It has an effect on everyone. And we have to be conscious about that. We have to do our role to actually try to reduce the harm that is being done when people stand up for themselves. So I just want to encourage everybody to be aware of those things and to think about this as it's not a black issue, it's an everybody issue right now, because everybody is out on the front lines fighting for Black lives to matter, and everybody could be experiencing mental health symptoms at this moment. So let's do what we can to actually help our communities be well. And if we don't have the resources to aid in that healing, we do not need to be further contributing to the harm. Thank you.
And next we'll have commentary from our cultural frontline leadership, Donovan Smith, who's also an author on our report against the riot control agents that are being used against our citizens. Donovan?
So one of the other things with this, in terms of it being a public health threat, is the Portland Police Bureau was under investigation from the Department of Justice, and the settlement that came out of that said there was a absorbent amount of abuse towards people with mental health issues by the Portland Police Bureau. So just in terms of thinking about mental health and the already existing inequities that existed through the Bureau with that, that's something that we need to keep centered. But also something to consider is that the RCAs weren't studied as part of that Department of Justice settlement. So again, as it was named earlier, we just kind of accept these things as being part of our general practice within the city, along with police as they exist, as just kind of being the norm. But the norm is killing people, and it's exacerbating other systemic inequities. Portland Police Bureau come into contact with Black folks in this city, and all the data that they track with disparities, whether that's arrests, whether that's how much they're beating on folks, and we're only 6% of the city's population. So it's just ironic as people are continuing to protest, as is their constitutional right, for Black lives to matter in this city, that we're using something that is just exacerbating the same inequities that people have been talking about for decades here. So yeah, that's kind of the core of what I wanted to say in terms of the inequities. But yeah.
So I just wanted to remind people that they can see the RCA study on Don't Shoot Portland's website. That's Don't Shoot Portland, don'tshootpdx.org. Also, there's a mutual aid form on a Linktree document that's available on our Instagram page, which is also Don't Shoot PDX. And there's a link there to get legal access if you've been experiencing the RCA response to your protesting. We'd like for you to stand up for yourself. We're standing here in solidarity with you, but reach out to us if you feel like you've been affected by any of the things that you heard today. And if you're an agency or you're a concerned community member, please grab the RCA report from our website and share it widely in your networks. Make sure that people are very informed about this information. We have infographics coming soon, and there's going to be more events like this where you'll be able to speak to the professionals involved with drafting the documents. Also, I just wanted to be mindful again to say that in my opinion, that because we were on a national pandemic where we had to basically self-isolate for 60 days, I believe that it is the job of our Attorney General and our Governor to make sure that the safety and health and well-being of all of the people in the state of Oregon is the first concern in any instance. And when we talk about uprisings of civil unrest or the expression of free speech, I think that the concern of our city and the government should be into protecting the rights of those protesters, not to violate their rights, and then also not to poison them or cause harm. The fact that harm has been caused, and I believe that it is not only physical, mental, and emotional, I believe that they are being vindictive in the use of tear gas during a pandemic where we know that the attack on our respiratory systems could cause death. So while we're saying stop killing us, we're asking you not to use violence against us, but to understand that we're trying to undermine and dismantle a system of oppression that people do benefit from. And with what you see through the uprisings across this country is that people that are concerned are coming to terms with that. And so we ask you to stand up, speak out, and stand in solidarity with us. Read the report, share the report. It's valid in your community too. Black Power. Woo!
Oh, wow.
Black Power.
Beautiful.
Thank you.
Thank you.
Anything else? Anything else you'd like to
Yeah,
say?
you want to tell them who we're being represented by and how to get in contact with the lawyers if they have questions?
Sure, yeah.